Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
All right. So now we're starting to discuss the early pregnancy, not exactly loss, but just early pregnancy and its problems. This thing, Shreya is there with us to present the case. Yes, you can start, Shreya.
Yes, ma'am. Just 1 second.
Yeah.
Should I start?
Yeah, please go ahead.
I am presenting a case of Mrs. A, wife of Mr. A, resident of Rishra, West Bengal, 28 years age. She is gravida 2, para 0, abortion 1. She is a homemaker by occupation. She has been married since 3 years and her last menstrual period was 7 weeks back. Her estimated gestation age is 7 weeks.
Okay.
Coming to chief complaints, she presented to the hospital with 7 weeks of an amenorrhea with complaint of vaginal bleeding and lower abdominal pain since 2 days.
Okay.
Then coming to history of
No. Just a minute here, Shreya. So suppose a patient comes to you. Over here, one thing which I always ask my students to say, which I would also tell you to speak as well, Shreya, will be that she's LMP was 7 weeks ago. With her regular menses, her estimated gestational age is also 7 weeks. Unlike our patient, which we just dealt with, who is 2.5 months when she gets period once. So with her, we'll not say 7 weeks, right? So we'll say with the regular menstrual periods, her estimated gestational age is 7 weeks. Okay, that is very important in our case, because if you're having irregular menses, then everything will fall apart from here onwards.
Yes.
She's come to you with second, this is the second time she's pregnant. Previous time she's already had and
abortion.
7 weeks with bleeding. So what is the DD which is coming in your mind right now? What all things do you expect we will be asking her to rule out? So to rule out, you need to have some DD in your mind. Yes.
Ma'am, it is like only 7 weeks. Yeah, it is only 7 weeks. So it can also be like she's having some delayed menses. It can be one of her
very good.
differential diagnosis.
Have we ever said that she's having UPT positive? We didn't establish it. Have we established this? We did not establish it. Could be normal menses. Yes, one. Very good. Anything else? Guys, everyone is writing down, okay? Like I always say, Shreya is not alone. We all will help her out. Yes.
It can also be, as of the case, it can be a case of early pregnancy loss. And it can also be like some, she might be having some, because early of some like hormone.
Abortion. You said that, huh? It could be delayed menses, it could be abortion. Okay, anything else?
Nothing specific based on this small mistake like I can think of, ma'am.
Can it be ectopic
I guess
pregnancy?
I am not able to answer it.
Okay.
Sorry,
can it be ectopic pregnancy?
Yeah, ma'am. It can be an ectopic pregnancy.
Can it be a local bleeding because of any other causes? Maybe she's having cervical polyp.
Yeah, some cervical pathology. Yeah.
Isn't it? Okay.
Implantation bleed can, but it will not cause that much bleeding, I guess.
See, right now, Shreya, we don't know how much bleeding she has. Correct? We just know she's having some bleeding. So it could be bleeding in early pregnancy also. She might not have abortion. It could just be bleeding in early pregnancy. A normal pregnancy with bleeding. Threatened abortion. Yes. Threatened abortion is what? Cardiac activity positive and still she's having bleeding. That is threatened abortion. So she can have bleeding. So this is the reason why I stopped this slide from you. So it could be normal periods. It could be early pregnancy with bleeding. It could be frank abortion. It could be ectopic. It could be molar. Molar pregnancy, isn't it? Or it could be some local cause, a polyp, malignancy, vaginitis, any problem. Local could be local causes. So much DD we have. Yes, Shreya?
Yes.
This is what happens when we study together. That one is thinking only 2 causes. One is thinking the other 2 causes. I'm thinking 4 causes. So now together we have put up at least 7, 8 causes together. Correct? Yes. So these are the different things which are running in my mind when I'm talking to a patient who's come to me with 7 weeks amenorrhea with previous history of regular menses. I'm thinking probably it's pregnancy. And I'm thinking it could be anything, right? From pregnancy to early, to abortion, to normal periods, to molar pregnancy, to maybe twin gestation, to local causes. And now slowly in HOPI, I will illustrate or negate either one of these cases. Yes. Now tell me your HOPI.
History of presenting illness. Mrs. A reported light to moderate vaginal bleeding for the past 2 days. Pads soaked, 3 pads were soaked per day with history of passage of clots. Cramp, there were lower abdominal cramps which started along with the bleeding. She had no history of any similar pain before. She had no history of passage of any products of conception, no history of fever or foul smelling discharge. No, no severe abdominal pain, syncopal episodes, or severe abdominal tenderness. No history of trauma. Yes, ma'am.
You will tell me each of these things. Why did you ask these things to? So no, she's having light to moderate vaginal bleeding since the past 2 days. Okay,
Yes.
she's soaking 2 to 3 pads a day. That means it's looking almost like a normal period, right? The clots are also present. So now I'm a little concerned. She's having cramps also in the lower abdominal pain started along with the bleeding. So I'm associating the pain along with the bleeding. And she never had this kind of history before. Correct?
Yes, ma'am.
Now you're asking a couple of other things. No history of passage of products of conception. Clearly, you're now thinking in terms of abortion. Anything else? Now, what are you thinking when you say no history of fever, foul smelling discharge?
Sorry, ma'am, I cannot hear you.
What is the meaning? Why did we ask no history of fever or foul smelling discharge?
Ma'am, to rule out any some infectious causes, if at all.
Okay.
I'm
Okay.
not
Anything
able
else?
to hear you.
Guys, my voice is clear or not? Shreya, you are not able to hear me?
Yeah, ma'am. Now I'm able to hear. Now I'm able to hear. Yeah.
All right. What about others? Are you able to hear me? Because this will go in recording, guys. It will go in recording for other students who are not able to attend. See, we are around 20 people, and the class are 8 to 10. So there are so many people who are not there in the class, maybe busy with their duties or whatever reasons, or they're just shy. Like in my batch 1, there were a lot of shy people who will not present the case, who have taken the course but not presenting the case, shying away from even attending the class. So I have this bad. It's okay. I don't mind all these things. I always emphasize that when you've taken it, let it be very positive. I hardly criticize anyone in my class. I always encourage. So my idea of taking these classes is to boost inside you the confidence to speak in front of your examiners. If you will not be able to speak in front of me, how will you speak in front of them, right? So, but still there are people who are so shy. So for all those people, I want a proper recording. So please let me know if I'm not clear. Guys, am I clear? The other people? All right. So yeah, no history of severe pain, syncopal episodes, severe abdominal tenderness. What are we trying to rule out here?
Ma'am, if at all there was history of any fall or some accidental fall or something, so that because of that, because of low blood sugar, she's having some syncopal episode that way. I'm thinking.
Shreya, don't say that in exam because it's very categorical of ectopic pregnancy, all these things. Severe pain in abdomen, syncopal episodes, severe abdominal tenderness, they are all falling for ectopic pregnancy, which is a clear DD in your case. So don't say this, what you just said, okay? Extremely important. In front of examiners, be very, very relevant. Here, these are very categorical. What is the triad of ectopic, by the way? Anyone in the class?
Dizziness.
Yes? You can also speak, Shreya, no problem. Triad of ectopic. Amenorrhea, pain abdomen, what else? And bleeding, PV bleeding, isn't it? Amenorrhea, PV bleeding, and pain in abdomen. So she's having pain, she's having bleeding, she's having amenorrhea. So How will we find out whether she's having ectopic pregnancy? Ectopic pregnancy, if it gets ruptured, she will have syncopal episodes. And before that, she will have acute abdominal pain with tenderness because abdomen will be angry. And then clear cut, no history of trauma. No history of trauma because then she's not having any internal bleeding or something, correct?
Yes,
Now, a
ma'am.
little word about her current pregnancy. So, she's trying to tell us what all she has ruled out. She's ruled out ectopic. She's ruled out any trauma. She's ruled out any local cause because there's no history of a foul-smelling discharge, so probably no PID or any local cause, and no history of any abortion. So, because there's no history of any passage of products of conception. So, these things she's tried to be. They are very relevant details. Yes. History of present pregnancy. Tell me.
Yeah. The pregnancy was confirmed by a positive urine pregnancy test, which was done at home 2 weeks ago. It was a spontaneous conception. On antenatal checkup, none was done yet,
Yes.
and it is her first presentation during pregnancy.
Okay. There's anything
And
specific you want to tell me up till now? Anything?
it was just a positive pregnancy
Nothing.
test, ma'am, and yeah.
Nothing is specific. Okay.
Yeah.
And in her obstetric history, anything you want to say? What was the last abortion like?
Ma'am, it is given further more that it was a spontaneous abortion at 9 weeks of gestation, which was managed conservatively, and it was 1 year back.
Okay. She has no living children and she never used any contraception.
Yeah.
All right. And she never had any excessive bleeding in the previous pregnancy as well. And there was no intermenstrual bleeding probably in between. Okay. You tell me the menstrual histories and ask you a few questions. Anything important in a menstrual history that you would like to tell me or ask the patient or anything else?
There were regular cycles, 28-day cycle, last menstrual period 7 weeks ago, positive home pregnancy test 2 weeks back.
Okay,
And
now go on. And
yeah, ma'am, that is it.
that's it. Okay, so you are also going to answer, Shreya, and all my sleeping beauties in the class will answer this question now. What, according to you, is an important menstrual history that should not be missed in this case because we were asking her complaints of bleeding PV in pregnancy. And one of the DDs was, so what relevant menstrual history would you like to ask?
Number of days she has menses, type of cycles, if they are regular cycles,
That you
and
asked. Okay, that you.
then if there is passage of clots or association with dysmenorrhea in general, and
Okay. Anything else? Specific and
number
relevant
of
to your
pads
case.
used, number of pads soaked per cycle.
How will that change anything? Very good. Ashi has got the answer. Why Ashi intermenstrual bleeding am I interested in? Shreya, why am I interested in intermenstrual bleeding?
If at all she has some pre-existing pathology like polyp or
Exactly. Yes.
polyp mostly.
Yes.
Yeah.
I remember in one of my DDs, it was a local cause also. Maybe it's just a normal pregnancy and she's having some local cause because of which she's bleeding again and again. Correct?
Yes.
So if I don't ask her intermenstrual bleeding history, how will I know that she is having some local cause or it's because of her pregnancy that she's having bleeding? I'm not able to then know intermenstrual bleeding. Okay? That's just one sentence. It will impress your examiner. Okay, that she has not even left the small teeny weeny bit of information as well. Because here you very clearly said polyp is one of the DDs. So here you are getting a chance to prove yourself. And you will not utilize this chance. Yes, Shreya?
Yes, ma'am. Yes, ma'am.
All right. Now, is there anything significant in medical or surgical history for your case?
No, ma'am, nothing significant according to the history. No history of hypertension, no history of diabetes, no history of thyroid disorder, no history of any coagulopathy, no history of SLE.
if she is on any blood thinners, she can bleed even in normal pregnancy. And
Yes,
we
ma'am.
need to know if she's on a very blood thinners, because if she started bleeding, we might have to stop the blood thinners, give her excessive coagulating agents, and then probably she'll have excessive bleeding. So be ready for, hemoglobin assessment, and if required, need for arrangement of blood as well.
Yes,
So
ma'am.
this one line is extremely important in medical and surgical history. Now, guys, are you understanding what examiner is looking at you? How you are looking at your case and how examiner is looking at your case. You're too close to your case and we are far away. Are you seeing this, Shreya? Are you appreciating this
Yes, ma'am.
part? That for you,
Yes, ma'am.
everything is important. For me, only one sentence is important, which is relevant for your case. Okay, everything else I expect you to write down. But when I ask you, is there any specific thing that you'd like to tell me, positive or negative? You will have to tell me one thing. Correct?
Yes.
All right.